Who's the right doctor for me? Everyone deserves a clinician that treats their patients like a trusted partner in the treatment of his or her own body. Doctors should be willing to listen to you, consider your suggestions, and believe you when you tell them how much you eat, how often you exercise, and any symptoms or pain you're experiencing. If your doctor doesn't listen, is authoritarian without considering your input, or fat shames you, consider getting a new doctor. You know when the fit is right. For treatment of lipedema, please consider going to see a specialist who has been trained and knows the standard of care, so they aren't trying untested methods, medicines that aren't known to be effective or related, or that try to give you things like diuretics, which can be counterproductive for patients with lipedema. Chapter 6. The bad news? You literally have to take charge. A common thread that I see with members of the lipedema community online is that we are all looking for information to figure out our disease, the treatments, where to go, and so forth. There are a couple of companies out there that will attempt to guide you to receiving insurance approvals, but there, so far that I know of, isn't a company that will take you from soup to nuts in the journey of lipedema. Personally, I had to basically demand that my doctor give me tests, even repeatedly, and then when I heard the word lymphedema, went back and asked for a referral to a therapist. I then had to get help and support by looking to social media, as I didn't know what resources were available in Oklahoma as far as support or trained providers. Sadly, there wasn't anyone here for me to reach out to. My therapist is trained in lymphedema and is certified in water therapy. Fortunately, the technique she uses also apply to lipedema, but she has had to learn a lot along the way. Now I refer other lipedema patients to her when they're getting started and in my area. Sometimes we see each other in the waiting room. I had to take the initiative to call Dr. Schwartz, go back and forth to pre-op appointments in my hometown, get the COVID tests, the blood work, schedule the pre-op cardiac testing, all individually and without help. I did the research on aftercare and scheduled that. All of the providers at the time I was going through surgery were not connected to each other, and there was no streamlined process or checklist to go through. There was very little information out there on what post-surgical recovery was really like. They tell you you'll leak, but really you do not know until you live it. Believe me. Even over the course of the last year, research on lipedema has grown exponentially. There are more and more sites popping up, led by patients and advocates, to share and collate information, more sharing on social media, and more awareness with doctors, even more books. And we need every one of these things and more to continue to raise awareness as long as women are going untreated. If you're new to the lipedema journey, be persistent and insistent and consistent in demanding your treatment and asking for help. Hopefully someone out there is making a full-service company supporting patients from the time they think they have lipedema to testing, pre-op testing, and providing compression, post-surgical care, and lifetime treatment. But we're not totally there yet. It'd be even better if the companies were spread across the globe instead of patients having to travel long distances to find that one specialist who will help. For now, we are grateful to the doctors and researchers, therapists, and nurses who have dedicated their lives to women with a disease that is offensive to some in medicine. We thank you and hope you will continue to help us.